Decision support systems are becoming a core investment area for hospitals and healthcare enterprises. As clinical data grows in volume and complexity, organizations are deploying CDSS platforms to improve decision accuracy, reduce medical errors, and enhance patient outcomes. However, building an enterprise CDSS system is not a standard software project. It combines clinical intelligence, data integration, regulatory compliance, and advanced analytics, which makes cost estimation more complex. In this video, we will break down the realistic cost of building enterprise CDSS software and the factors that influence that investment. Let us begin with the baseline. A basic CDSS platform focused on rule-based alerts, clinical guidelines integration, and simple EHR connectivity typically requires an investment between $120,000 and $250,000. This level includes standard data integration, clinician dashboards, and predefined rule engines for alerts such as drug interactions or preventative care reminders. As the system becomes more advanced, costs increase significantly. A mid-level enterprise CDSS platform that includes real-time data processing, advanced workflow integration, multi-department support, and more complex rule engines typically ranges between $250,000 and $500,000. These systems often include deeper EHR integration, configurable clinical workflows, and enhanced reporting capabilities. For full-scale enterprise CDSS platforms, the investment is considerably higher. Systems that include AI-driven predictive analytics, patient risk scoring, imaging analysis, multi-hospital deployment, and continuous learning models can exceed $500,000 to $1 million or more, depending on the complexity of clinical models and data infrastructure. Now, let us break down the key cost drivers. The first major factor is data integration. CDSS platforms must integrate with electronic health records, laboratory systems, imaging systems, and other hospital data sources. Supporting standards such as HL7 and FHIR requires specialized engineering and increases development effort. The second cost driver is the decision engine. Rule-based engines require clinical guideline mapping and logic development. AI-driven models require data science expertise, model training, validation, and continuous monitoring infrastructure. This significantly increases cost compared to rule-based systems. The third factor is compliance and validation. CDSS platforms must comply with healthcare regulations such as HIPAA and GDPR. If the system qualifies as software as a medical device, additional validation, documentation, and regulatory approvals are required, increasing both time and cost. Security architecture also contributes to investment. Encryption, access control, audit logging, secure APIs, and continuous monitoring are essential to protect sensitive patient data and maintain compliance. User interface design plays an important role. Clinician dashboards must present data clearly and deliver actionable insights without overwhelming users. Designing for multiple roles across departments adds to development complexity. Infrastructure and scalability are another major component. Enterprise CDSS systems must support real-time data processing, high availability, and large-scale deployments across hospital networks. Cloud infrastructure, data pipelines, and performance optimization increase overall cost. Testing and clinical validation are critical phases. CDSS platforms must undergo functional testing, performance testing, usability testing, and clinical validation. Accuracy is essential, as incorrect recommendations can impact patient safety. Ongoing maintenance must also be considered. CDSS systems require continuous updates to clinical guidelines, model retraining, system monitoring, and compliance adjustments. Most enterprise platforms allocate $80,000 to $200,000 annually for maintenance and improvements. The final cost depends on system complexity, level of AI integration, number of data sources, regulatory requirements, and deployment scale. However, the value of CDSS should be evaluated strategically. A well-designed CDSS platform improves clinical decision-making, reduces errors, enhances patient outcomes, and increases operational efficiency across healthcare organizations. At Intellivon, we help healthcare enterprises design and build secure, scalable, and clinically validated CDSS platforms aligned with real-world workflows and regulatory standards. If you are planning to build enterprise CDSS software and need clarity on investment and architecture, we are ready to help. Thanks for watching. See you in the next video.